Good morning to you. This is to Radio Breakfast with me, Julia Hartley-Brewer. Thank you very much indeed for your company. 8:25 is the time. Let's talk to Dr. Renee and Hoenderkamp now, who's an NHS GP and medical writer and joins us. Good morning to you.
Good morning,
Thank
Julia.
you very
How are
much.
you?
Very well indeed. Lovely to speak to you. And now, obviously, yesterday we had the budget, and one of the things I found really striking watching it, actually from overseas yesterday, was the number of masks we suddenly saw in Parliament again. And I thought it was quite risible that the Labour bench is quite happily not wearing masks at Labour Party conference, at parties, karaoke, in the conference hall. So they were suddenly they had them back on when Parliament resumed. And then after pressure on the front bench, we saw an awful, pretty much the majority of the Tory front benches donning their masks as well. What did you make of that? The sort of the mask theatre that went on yesterday?
I mean, all of this stuff is theatre, isn't it, Julia? We comment on this. We need to have a website where everyone can put the mask theatre stories up because they're ridiculous. But I think it was predictable that this would happen. I think they're thinking about reintroducing mask mandates. Therefore, they've actually got to signal to us that they're now doing what they're going to tell us to do. And that's actually what makes me sad about it, because it's a signal for what might come.
Well, indeed, yes. A lot of people say, oh, what does it matter to you? I guess people on social media say, what does it matter to you if people are wearing a mask if you don't wear one? Is that because exactly it's not them just saying, we're wearing a mask. It's telling us that we should be wearing one, and eventually we will be made to wear one. And of course, never lost that mask mandate in Wales and in Scotland as well. And we have seen that mask mandate in large parts of Europe. Although it's interesting, you see countries. I've just come back from Portugal where they have masks. I hate it. The staff are wearing masks in restaurants, but the customers aren't. But you are seeing them dropping vaccine passports while other countries are bringing them in. So there's been a big variety of this, but there's lots of talk about these demands for Plan B. We were just discussing with Ian Duncan-Smith, and vaccine passports and masks, and of course we've had the National Education Union, as per usual, joining the BMA and all others, are talking about bringing masks back in our schools. You're a GP, you're as aware as anyone, no doubt, that huge number of children have been getting COVID lately, and almost all of them have been just fine with it. So what argument is there for masks to come back into school other than just as a sop to teaching unions and the BMA?
Well, I'm afraid it is exactly that. There is no argument at all to have masks in school. In fact, there are lots of arguments to not have masks in school, because there are so many harms that are done by masks. And I'm so tired of hearing people say, oh, it's nothing, it's easy to wear a mask. It isn't. I have seen children over the last 20 months been absolutely reduced from gregarious, outgoing, confident young teenagers into gibbering wrecks who are having panic attacks all day and coming to see me with their parents because they don't know how to cope anymore. And they don't know how to cope because they've been convinced by society that they are the people that are letting grandma die. They are the people that are catching this germ at school and then bringing it home and spreading it throughout society. And we need to stop. We need to get back to normal. We need our children to be educated, mask free, close the windows when it's cold so they're not all sitting there shivering in their coats, and get on with life. They don't need this, and it doesn't do anything. And bear in mind that they're also wearing these masks only in communal areas. So when they're sitting in their classrooms, then COVID doesn't affect them apparently, or doesn't spread. But as soon as they go into the corridors, it's lethal. And then when they get to the school gates, it goes away again. As long as they've got this filthy little mask that they've got in their pocket, that they've probably had for 3 weeks, that they're taking in and out, shoving on their face, spreading everything around, probably just the local cold that's going around. And it's just unfair. And I object as a doctor to being castigated by the zealots on social media, who are also doctors, lots of them, telling me that I'm happy for children to die, and that I'm really a horrible person because I'm wishing ill on our children. And actually, it's so ironic, because what I want our children to have healthy mental health and physical health and to get on with their education. And losing that is more damaging long term than anything else we could do.
Oh, absolutely. I completely agree with you. That message that has gone out to children. When I see, especially a parent walk along with a child who's sort of 5 or 6 years old wearing a mask, I mean, it absolutely breaks my soul. It really does.
Me too.
Seeing that, and again, they're just at virtually zero risk. I mean, it's close to zero as to be meaningless risk. I might say my daughter had COVID a couple of weeks ago. It didn't for a nanosecond bother me that she had got tested positive for COVID. Other than that, oh well, that was going to mess up some of our half-term plans, and that was her concern as well. Felt a little bit unwell, no more unwell than she would have been with a bad cold, and that is how it affects the vast majority of those who are even aware of having any symptoms at all. But this is the thing, it's that ongoing message, isn't it, that somehow children are the spreaders. Children spread it to each other, but
Yes.
Here's an idea: when it's going around your child's school, don't mix with the grandparents, which is what we did. We haven't seen grandparents for a few weeks. That's clearly the sensible thing to do, and parents testing themselves to be extra sure if they're in the home with a child with COVID. But this is the thing, it's all got, it doesn't matter how good the figures are. We've seen a week on week fall, I mean, again and again, in cases and in deaths. We are clearly over this latest spike without any extra measures, and yet the same people are making the same demands for us to have restrictions on our lives once again.
Yes, and actually, if you look at our nearest neighbours, Scotland and Wales, that have basically had mask mandates for the entire time, they've actually done worse than we have on the figures.
Yes.
So, there's no evidence that this works. There's also very little evidence that children are super spreaders. And don't forget, every vulnerable child, every vulnerable adult, actually every adult has had a vaccine. We have done everything that we possibly can to stop as many people as we possibly can from dying. It is time to do what Sajid said and live with this virus and get our children back to normal. It's going to be much harder, Julia, in my opinion, to actually reverse this psychology that we have drilled into everybody than it was to actually put it there.